I'm Dr. Maynard, bariatric surgery at Bariatrics in Atlanta, Georgia. Bringing a video today to you to talk about why we do bariatric surgery and to maybe give you a brief overview of how our surgeries have evolved over time. Weight loss surgery has always been part of surgery as a whole. Once we figured out we could cut and sew and make things better, the immediate sense went to how can we make our lives overall better. The first inkling of this was back in the 1950s, where they did the 90-30 operation, where we took the intestine and connected it down to about 10 centimeters from the ileocecal valve. Lots of loose stools, lots of weight loss, but also lots of issues and problems. As we learned from that, we eventually evolved doing shorter channels, eventually the gastric bypass, where you made the stomach smaller, became the preeminent surgery, and that was done open, and then over time it was converted to be able to do it laparoscopically, and that really took off because it brought a lot of the risk out of the surgery. Concurrently to that, you had gastric duodenal switches, which was a surgery that was started in the 1970s in Italy with Dr. Scopinero. And then subsequently, Dr. Hess did the modern version of the duodenal switch. Along with that, it was realized that you could do the gastric sleeve as a standalone operation, and that started to become the preeminent surgery over time. In between those two, you had an area where we did lap bands, where you would bring a plastic silastic pillow around the top part of the stomach, making the stomach smaller without doing a resection and limiting the amount of food that was coming in. And around that, they developed a process to help patients maintain their weight. With the duodenal switches, you did both a gastric sleeve and sort of a Roux and Y combination. They started doing this sleeve as a standalone operation to get a lot of weight loss off before coming back and doing the completion operation. A fair amount of these people did very well with just the sleeve, and so that became sort of a standalone operation. As we built the framework of support around that, we realized that it was a very simple, straightforward operation that allowed you to have good weight loss, and with a good plan in place, give you good results that were sustainable over the long term. So where we are today, we've moved from open procedures to laparoscopic procedures to primarily robotic procedures today. Three big operations. One is the gastric sleeve as a standalone. Two is the gastric bypass. And three would be the duodenal switch. So those are your three main operations. There's several other operations that can be done. There's putting large balloons in the stomach and restricting the amount of intake. There is endoscopic surgery, where you can come through the mouth and go in and actually do a sleeve gastrectomy endoscopically, and that's being done as a surgery as well. So there are many options for you as far as the different surgical options. At the bottom of all of that comes the ability to change your life substantially. If you can change the habits you have, maintain those changes consistently, then you give yourself the opportunity to, one, lose the weight, and two, maintain the weight loss over time. Thank you for looking at this video. If you like our channel, please subscribe to our channel. Click the link below so we can have a conversation in the office.